ठीक है. So which all portions which was left in the third unit I am leaving like that. When you people come offline hai na, that time I will see. Okay.
Okay, ma'am.
Okay, yes. So today we will start with the next unit, that is normal puparium. So from the word puparium, it is understood that it is a time period, or it is a duration of 6 weeks. That is starting from after the delivery of the baby till 6 weeks time period. When the mother has delivered the baby after the childbirth to 6 weeks of time period is known as normal puparium. If you are seeing the definition, period after childbirth, which the organs go back to the pre-pregnancy status. So when all the organs after the pregnancy, when it revert back to the pre-pregnant stage, it will take nearly about 6 weeks time. So that time period is known as normal puparial time period. You people should take the screenshot of my screen and you should write the notes. Understood?
Yes.
Yes.
So what are the objectives of normal puparial time period? So if you're seeing the objectives, we have to restore the health of the women. Women who underwent the pregnancy, during the pregnancy time, there were so many health issues. Like if you're seeing like minor disorders were there, women's body undergone many changes. So from that, we have to restore her health back to the normal pre-pregnancy status. So one of our objective during the puerperal time period is to restore the health of the women. So what is the next one? To promote the lactation. So every mother after the childbirth, it is one of her responsibility to give breastfeeding. So normally this primary gravida mothers and all, they may feel difficulty. So what you have to do, you have to educate the mother and promote the lactation process, especially in a primary gravida mother. Next, if you're seeing to prevent the infections, puerperal time period is a time period where the women's immune system has little bit compromised and she may have the chances of infection. So what you have to do as a healthcare professional, you should see that you are preventing the mother from all sorts of infections. So this infection can maybe in the, if it is an LSCS delivery, at the site of that cesarean, there is a chance of infection. If it is normal delivery and if the episiotomy is done, what is episiotomy? Anybody can answer what is episiotomy?
Ma'am, it is a
The
surgical
suturing while
on
It is a
perineum. Surgical incision on the perineum.
It is a surgical incision on the perineum. So if the woman is having an episiotomy wound, there is a chance of infection. If she is not properly taking care of the hygiene, there is a chance of infection in her episiotomy wound. So our next objective is to prevent the infection. Next one, to note the progress of the baby. So if you're seeing how to note the progress of the baby, like whether the baby's weight is increasing or not, whether the normal growth and development is there for the baby, that is our next objective. Next, advising on immunization, especially baby's immunization. We should sensitize all the mothers regarding the immunization to be done for the baby. हाँ, अभी मेरी स्क्रीन विजिबल है?
Yes, ma'am.
Yes, ma'am.
ठीक है. So next is we have to advise the mother on immunization process. Next one, that is specially for the baby's immunization. And the last one is we have to impact the family planning guidance. If the mother is a primary gravida mother and if she has given birth to a baby, you can sensitize the mother, you can health educate the mother for the family planning services. Or if she is having 2 or 3 child, you can able to give health education regarding the permanent family planning method. So these are the objectives of normal puerperium. Fine. So what are the objectives of the normal puerperal time period? You have to restore the health of the mother and also the baby. Next one, to promote the lactation, to prevent infection. That is again mother and baby. You have to prevent the mother and baby from all sorts of infection. You have to note the progress of the baby in terms of height, weight, or other developmental milestones. And also you have to advise to immunize the child and to impart the family planning measures or family planning techniques. So if you're seeing the next slide, it is the physiological changes during the puerperal time period. Jonita, वो मेल मुझे भेज दो, वो भी बनाया है ना विनीत ने, वो जो MOM, हाँ, वो मुझे मेल कर दो यार. So next, if you're seeing the physiological changes during the pregnancy, during the puerperal time period, it is the changes in reproductive system. So changes in reproductive system, if you're seeing the uterus, what happens to the uterus during the puerperal time period? Uterus, it was enlarged in size till the 9th month, and that uterus, it will come back to the normal size and shape. If you're seeing during the first 10 days, the uterus will reduce its size and the weight of the uterus will be 1 kg. What was the weight of the uterus during pregnancy time period? Whether anyone remembers?
Ma'am, 900 to 1100.
Very good.
Gram.
900 to 1100 gram. So from there, the uterus, it may be reduced. It may come back to its normal. Say it is not weighs 1 kg. It is about weighing around 1 gram. It will come whenever it is 40 to 50 gram. During the first week, it may be 1 kg. From 1100 grams, it has converted to 1 kg. And at the end of the 10 days, it may come around 50 grams to 60 grams, or nearly on an average, if you're taking 70 grams, the uterus will come. Next one, uterus returns back to the normal stage. That means uterus which was increased in size, increased in its weight, it may come back to the normal pre-pregnancy status. When the uterus and its supporting structures come back to the normal size and shape, it is known as involution of uterus. So what is involution of uterus? When the uterus and the supporting structures, when it is come back, when it comes back to the normal pre-pregnancy status, weight or height or the size, you will call it as involution of uterus. If it is not coming back to the proper size, shape or weight as the non-pregnancy state, then it is known as sub-involution of uterus. Understood what is involution and sub-involution? In simple, it is involution means reverting back of the uterus to pre-pregnant status. If it is not reverting back to the pre-pregnancy status, it is known as sub-involution of the uterus. If you're seeing the fundal height, just after the delivery, the fundus can be palpated below the umbilicus. And 1 week after the delivery, the fundus is palpated above the symphysis pubis. And after 10 days of delivery, we cannot palpate the fundus. Clear? So fundal height, if you are seeing, after the delivery, it is just below the umbilicus. After 1 week of delivery, the fundus can be palpated above the symphysis pubis, and after 10 days, it is not at all palpable. Next, if you are seeing, what is the discharges from the uterus? Discharges after delivery from vagina, there may be some discharges. The discharge from the vagina after the delivery, it is known as lochia. The lochia, it is classified into 3: lochia rubra, lochia serosa and lochia alba. Lochia rubra is red in color, and this you can see between 3 to 5 days of delivery. After delivery, 3 to 5 days, you can see this lochia rubra. Lochia serosa, which is light yellowish in color, you can see this from 5th day to 10th day. And Lochia alba, which is whitish pink in color, you can see this after 10 days of delivery. So these are the 3 types of discharges from the uterus. From the uterus, there are 3 types of discharges, and the discharges are known as lochia, divided into 3: lochia rubra, lochia serosa, and lochia alba. Fine.
Yes, ma'am.
Rare. Next is changes in the perineum. If you're seeing the perineal changes, the perineal muscles will regain its strength after the delivery, and the swelling, if there was any swelling in the perineum, the swelling, it may reduce after the delivery. Next, if you're seeing the endocrine system, the estrogen and progesterone. Progesterone was secreting in large amount during the pregnancy time period. So once the pregnancy completed, the level of the estrogen and progesterone, it may reduce, it may decrease. Oxytocin and prolactin, it will start to secrete, because prolactin, it will produce the milk, and the secretion process, it is done by the oxytocin. So oxytocin and prolactin, they may be secreting, and oxytocin secretes from where it is secreting? It is secreted from the posterior pituitary gland, and prolactin, it is secreted from the anterior pituitary gland, and the responsibility of prolactin is production of milk, and the responsibility of oxytocin is ejection of milk. Understood? So how many changes are there? If you're seeing estrogen and progesterone, it may reduce. The level of estrogen and progesterone, it is reducing. At the same time, oxytocin and prolactin, it is increasing. Oxytocin, prolactin, it is responsible for the production of milk, and it is secreted from the anterior pituitary. Then the oxytocin, it is responsible for the ejection of milk, and this is secreted from the posterior pituitary gland. Next, if you are seeing the cardiovascular system. So if you're seeing the cardiovascular system, cardiac output, it was increased during the pregnancy, and that cardiac output, it may come to the normal within the first hour of delivery. After the first hour of delivery, this thing, the cardiac output, it may come to the normal. If you're seeing the blood components, increased loss of plasma. Plasma losage will be there for the first 72 hours, and erythrocyte sedimentation rate, it is increased. There may be leukocytosis, and varicosities of legs and anus, it will be continued sometimes for some women throughout the puerperial time period also. So blood components, if you're seeing, loss of plasma is there, that is during the first 72 hours. The ESR rate, it is increasing. Leukocytosis may happen, and the varicosities of legs and anus can also happen for some women, or it may continue as a result of pregnancy also. So some women, they may have the varicosities in her anus and legs during the pregnancy, and that may continue throughout the puerperial time period also. Next, changes in the GI system. So mother feels hungry. So as she is a lactating mother, she feels hungry. Sometimes women may have constipation for 2 to 3 days, and women also experience increased thirst during the puerperial time period. So mother feels hungry, constipation is there for 2 to 3 days, and mother may have increased thirst. What is the changes in breast? Breast tenderness will be there for a minimum of 48 hours. Some women may have soft breast, and colostrum will be expressed. Colostrum is the first breast milk. So colostrum will be expressed from the breast. And some women may experience even that breast engorgement also. So what is breast engorgement? For the 1 to 2 days or on the third day, you can tell on the third day of postpartum, more amount of milk will be secreting from her breast, producing from her breast, but baby will not consume that much amount of milk. So at that time, what happens? The milk, it will get accumulated in the breast, and that accumulation of milk may cause some sort of pain. So when women experiences pain as a result of accumulation of milk in the breast, it is known as breast engorgement. So for the breast engorgement, we can give the treatment. So what treatment is there? Hot fermentation. Hot fermentation, it is nothing but putting a towel which is dipped in hot water, and you have to put that towel over her breast. So whenever you're applying the hot fermentation, the milk may be coming outside. So thereby the pain can be relieved from the breast. Understanding?
Yes, ma'am.
Only one student is listening. बाकी सारे वो on करके चले गया?
Yes, ma'am.
Yes, ma'am.
No, ma'am.
मैं यही बोल रही हूँ, next time है ना, in your next year, in 4th year, I will not continue this class. Again, there is no revision and all. Directly starting from the abnormal part. So you better listen. What are the changes in the abdomen? All the abdominal muscles will come to the normal tone and regain the strength within 6 weeks of time period. So abdomen is the last organ to come back to the normal size and shape. So normally this abdomen, it will regain its strength after the 6 weeks. Changes in the genitourinary system, if you're saying bladder, urethra, they may become edematous, and increased urinary output is there. Whenever the women experiences increased urinary output during the puerperal time, it is known as postpartum diuresis. So what is postpartum diuresis? Increased urinary output during the postnatal period. It is known as postpartum diuresis. What are the changes in the nervous system? Carpal tunnel syndrome is relieved. Now what is carpal tunnel syndrome?
Ma'am, numbness or tingling sensation in the fingers of the hand.
Very good. So I think Ujala is answering. So what is carpal tunnel syndrome? Women experiences some sort of pain in her fingertips. The tingling sensation or pricking sensation in the fingertips is known as carpal tunnel syndrome, and that was one of the minor disorder during the pregnancy. So when the women comes to the puerperal time period, during the puerperium, this carpal tunnel syndrome, it is relieved. And postpartum headache, some women may experience postpartum headache. So this headache can come as a reason for the tensions also. Women may have anxiety, like how to take care of the baby. She have to take care of herself. So because of all these things, women may have experienced postpartum headache. Next, if you're seeing what are the changes in the integumentary system. So in the integumentary system, if you're seeing chloasma, linea nigra, stria gravida, everything will disappear. So what was chloasma? It was the yellowish pigmentation seen over the face that may disappear. What is linea nigra? It was the line which was extending from the sternum to symphysis pubis. Even that also will disappear. Stria gravida, those are the stretch marks, and that may also disappear. And this stria gravida, which was brownish in color during the pregnancy, that may change the color. That is, it may become silvery lines during the puerperal time period. So the stria gravida, it comes to stria albicans. You will call it as stria albicans. The white silvery lines are known as stria albicans. So those are the changes in the integumentary system. And if you're seeing the vital signs, the pulse, it is raised for the first few hours, and there may be variation in temperature. In most of the women, there may be variation in temperature. That is about first 24 hours, there may be variation in temperature. So these are the physiological changes during the puerperal time period. So what are the physiological changes? In the reproductive system, you can see the uterus will come back to the normal size and shape. and if it is not coming back to the normal size and shape, it is known as subinvolution of uterus. Fundal height, if you are saying fundal height, it will start to reduce, and after this 10 days of puerperal period, you can not able to palpate the uterus abdominally. And there are 3 types of discharges from the uterus, that is lochia rubra, lochia cirrhosa and lochia alba. Lochia rubra is red in color, cirrhosa is yellowish in color, and alba is whitish pink in color. If you're seeing the perineum, what are the changes in the perineal muscles? The perineal muscles will regain its strength and it will come back to the normal size and shape. Endocrine activity, if you're saying progesterone and estrogen, it is declining. Oxytocin and prolactin, it is increasing. Cardiovascular system, that is cardiac output, it will come to normal. ESR rate is increased, leukocytosis rate is increased, and plasma rate is, loss of plasma, it is there. And if you're seeing the GI system, mother may feel hungry and thirsty, and she may have constipation for 2 to 3 days. What are the changes in the breast? That is, breast tenderness will be there for 48 hours, and women may have breast engorgement, and also colostrum will be expressed from the breast. If you're seeing the changes in the abdomen, abdominal muscles will return back to the normal tone within the 6 weeks. In the genitourinary, if you are seeing bladder and urethra, it may become edematous, and the urinary output, increased urinary output is there. We will call it as postpartum diuresis. Next, in the nervous system, that is, women may experience headache, and there may be carpal tunnel syndrome. It is also relieved. Integumentary system, if you are seeing all the changes, integumentary changes which happened in the pregnancy time period, that is cloasma, linea nigra and stria gravida, it will disappear, and stria gravida will change to stria albicans. Changes in the vital signs, if you are seeing, pulse rate, it is increased, and even the temperature is also increased for first 24 hours. So these all are the physiological changes in the puerperal time period. Any doubt?
No, ma'am.
नो मैम। आप लोग है ना, अपना अटेंडेंस सेंड कर दो। कौन है? पूजा, पूजा है इसमें?
Yes, ma'am.
पूजा अटेंडेंस शेयर कर दो, मुझे पर्सनली शेयर कर दो अटेंडेंस।
Okay, ma'am.
ठीक है, थैंक यू स्टूडेंट्स।
Thank you, ma'am.
Thank you, ma'am.
वो इसका स्क्रीनशॉट ले लिया सारे?
Yes, ma'am.
Ma'am, ले रही हूँ.
Write the notes in your notebook.
कर दो leave.